Cardiovascular disease is a chronic disease that causes millions of deaths worldwide, and they are preventable.
There is no such thing as a sudden heart attack. It is 30 years in the making. Cholesterol is a Europe-wide, in fact it's a global problem, and cholesterol is a very big risk factor for cardiovascular disease. In fact it causes half the heart attacks that happen. So it is a really important European level discussion around what we can do about it.
We have to bear in mind that there is a polarization. From one side, high cholesterol due to lifestyle, and from the other, high cholesterol due to genetic diseases. What has emerged is the discussion whether how to implement changes in lifestyle, but to me most important what came up is the question about familial disease, where you have familial hypercholesterolemia and people has to suffer from that without having any means, unless it's detected and properly treated, to control their cholesterol. Lifestyle changes will not affect that.
A condition called familial hypercholesterolemia, or FH for short, is an inherited form of high cholesterol, that you're born with 2 or 3 times more cholesterol in your body, and this can lead to early cardiovascular disease and possibly early death as early as 20s, 30s and 40s. So early prevention, intervention is really, really important, and by early I'm talking certainly in FH cases in very, very young years. I'd like to think almost at birth. And for other cholesterol areas, we could sort of look at from sort of 8, 9, 10 and upwards.
We will change the paradigm to moving from patients to citizens. When we are already patients, it's too late. We have to work with the patient for sure, because they need the treatment, the care, but it's better to work with citizens that is before. So, and we have one instrument, one tool, that is the health program. The health program is working mainly, one of the areas is prevention. So this is the role of the European Union, to help in the research with the Horizon 2020 program, also to help in the dissemination of the results and to help with the exchange of good practices.
The European community cannot do everything, cannot impose to member states some topics or some behaviors. However, supporting registries and starting registries about familial hypercholesterolemia, in my opinion, will be the most effective way to tackle that problem. That is, has got to be a pan-European registry to detect and follow the diagnosis of FH throughout Europe.
What it's going to require is stakeholders actually working with each other. We need communication and political action, as well as action from the health industry, and we need engagement with parts of the public sphere that deal with exercise, the health of children, right the way across the board. But it does require political action, and it requires investment.